We now have the pleasure of having another wonderful, and I'm sure will be very interesting presentation led by Dr. McGeeney, who you all know from Boston Medical Center. And we have the privilege, really, and the pleasure and the honor of having three folks that have unfortunate sufferers from this condition. And Brian and they will take us through their struggles, problems, wants, and needs, and hopefully shed some light on how we can maybe do a better job in our own day-to-day patient care. So, Dr. McGeeney.
One of my goals is not necessarily for you to learn just more about cluster headache, but the life and their interactions and experiences with the medical community, what they do say among themselves, what they say about us, their overall experience with the medical community, because you don't really get that so much in clinical practice. I'm particularly honored to have such experienced patients and advocates with me today. It really is a pleasure. And I'm just going to introduce them briefly, and then they will tell you a little bit about themselves. And I do hope to make this more interactive. I don't know if we have a roving mic. If not, I'll go with my lapel mic. We have a roving mic. Wonderful. And I think that the sort of things you're going to hear about, including the sort of, I'm going to tell you firstly about Ashley on the left. And Ashley has had episodic cluster since childhood, which she'll tell. She's a freelance medical writer. Let me tell you something that she may not tell you, and that in September she published a book for cluster patients. It is a fantastic book, and it is a must for all patients. And I'm not really here to sell anything, but this is a medical education for patients. And there is no other one, and it just happens to be very good and available on Amazon. And that was a wonderful contribution. She also runs a monthly Twitter discussion on cluster. The next one's coming up in a week or so. Maybe you could share that with us when you get a chance to talk. And that has got some attention. Her husband is to her right, and Andrew works in the financial world. And I think Andrew, we're particularly interested in hearing about Andrew's experiences as a child, because as a child he developed chronic cluster, and of course it took forever to make the diagnosis, and it just sounds horrific what he went through. To this day he has chronic cluster, and I'm delighted that he can manage to come along today with us. And finally, the gentleman who needs a little introduction among the cluster community, Bob Wald, who I mentioned earlier, founded a patient advocacy organization, which is a very successful one, by the way, founded in 2001 or thereabouts, for education advocacy, and they are incredibly well represented at Headache on the Hill, for instance, proportionally much more so than any other headache disorder, and which is wonderful, but they have a number of different pursuits. Bob, as you will hear, there's only one person in this room who gets enormous amounts of calls from cluster all the time, and that's Bob Wald. And he has spoken to more cluster people than anybody else in this room, period. More than that, there are calls in extremis, which he will mention, and the sort of things you couldn't make up, and what to do next. And without further ado, I want to pass the mic over to each one individually, just to expand on their experiences. And I will, take liberty to maybe bring up topics or ask them to expand on topics. And I will be taking comments from the floor. But firstly, Ashley.
Hi. Thank you for giving us the opportunity to speak and share the patient perspective. I'm Ashley O'Saddle. I started getting episodic cluster headaches in 2007. I was textbook from the beginning, getting 2-week episodic cycles every 6 months. The first attack I chalked up to dehydration because I was a lifeguard in high school, but they came back every day at the same time. My father took me to a neurologist who said I had cluster headaches. gave me a prednisone burst, and sent me on my way to college from Nebraska to Colorado. I thought he had cured the headaches, as he didn't explain that they would come back and I would need treatment for the rest of my life. So when they did come back 6 months later in college, I didn't know what to do. I had my roommate take me to the emergency room. I was crying, cradling my head, and pacing in the waiting room. I told them I had cluster headaches, but I distinctly remember the physician and nurses telling me they were migraines. They gave me IV fluids and a prescription for hydrocodone, which we all know does nothing for cluster headaches. The next day, I was back in the ER telling them the narcotic didn't work. They treated me like a drug seeker, and I understood never to come back. I then went to see a primary care physician at the University of Colorado who said she would only prescribe oral sumatriptan, and if that didn't work, we would try the nasal. But then the cycle ended. Still not understanding my condition, I continued college life thinking, thank God, they're gone for good. Then the next cycle, I went to urgent care, begging for sumatriptan injections, knowing I needed something fast-acting. Luckily, the urgent care doctor understood the necessity and thus began a several-year streak where I would use 2 injections per day for 2 weeks at a time, and then it would end. In 2012, I had a 35-day cycle in the spring and a 46-day cycle in the fall. I found myself begging my new primary care physician, who was the 5th I'd seen at the time, for help when insurance wouldn't cover any more injections. In the span of 35 days, I spent $900 on sumatriptan because it was my only option. That doctor was the first doctor who gave me hope. He realized he didn't know how to treat me, so he did his research, prescribed me oxygen, albeit he gave me a 5-liter per minute prescription with an oxygen concentrator, and referred me to a neurologist in Michigan. By the time I got to the Michigan Head Pain and Neurological Institute in 2014, I was fed up with physicians and friends who didn't understand what I went through every 6 months. I came prepared with a long list of questions, my full headache diary, and my diagnosis was confirmed. Dr. Arnaldo da Silva knew I needed high-flow oxygen at 12 to 15 liters per minute, and I now use 25 liters per minute, and referred me to Dr. Judy Lane in Denver. However, in the 2 hours of testing before I saw Dr. da Silva, 3 nurses told me I had migraines. I kept telling them when I'm in a cluster, when I'm having headaches, and they still believed that they were migraines because women don't have cluster headaches. This drawn-out process taught me that I was the only person who could help me. I had to fight so many doctors and nurses when I already had an official diagnosis. I was kicked out of the University of Colorado Hospital when I missed 2 appointments because I was having an attack and couldn't drive myself there. I was lucky to have supportive friends who would talk with the pharmacist when I couldn't. I have a father who helped me pay out of pocket when insurance failed me. In 2014, I bought several books from Amazon about cluster headaches, just to find that 2 only mentioned clusters in 1 paragraph or just 1 sentence, and another was haphazardly thrown together, offering only more confusion. That's when I decided to write the textbook that I needed when I was diagnosed. I found out about cluster busters and went to the 9th conference in Nashville, where I met Dr. McGeeney, Bob Wald, and my husband, Andrew Clemenshaw. For the first time, my pain was validated, and I heard heartbreaking stories that were too similar to mine. Men and women who were misdiagnosed with migraines for years, patients who were given the wrong oxygen prescription and denied fast-acting medications. This group of people, led by Bob, had found each other all because the healthcare industry failed them. You see, cluster headache patients will never stop searching for relief. They will only look elsewhere when a physician doesn't know how to treat them. I spent the next 3 years interviewing patients, their family members, and neurologists. I poured through research studies in the hope to understand cluster headaches more and provide a research for others like me who had been let down by the medical community. I'm proud to say that I accomplished that, but I look back and I wish it would have never been necessary. Thank you.
Thank you, Ashley. Wow. Andrew.
Hey, can everyone hear me? All right. I was 12 years old sitting in 8th grade algebra class, the first time that I ever felt it. Although I had no idea what it was at the time, I could feel the creeping aura over my shoulders. My left temple began to pulsate intensely, accompanied by a searing pain in the left side of my head, face, and my gums. Having never experienced a normal headache before this, I assumed it was just one of those regular headaches people always talked about, right? Unfortunately, that was just the beginning for me. After a few more attacks, my mother began to realize this wasn't just a one-time thing and something was really becoming very wrong. We went to my pediatric doctor, who immediately dismissed that what I was experiencing was legitimate. I was a young kid trying to skip school and responsibility. So we tried the OTC meds, the Excedrin migraine, tension headache, sinus headache, even that roll-on stick that's supposed to cure your headaches. All the variables. And after a few weeks of no success and a downward slippery slope, she realized this was not the solution to our problem. Considering that it could be something similar to, but not head pain, I was taken to an ENT who diagnosed me with a deviated septum as the cause of my pain and booked me for surgery. After a complete waste of time, pain, and money, the thought occurred that my wisdom teeth could be coming in. I was taken to an oral surgeon at the age of 13 who said while my wisdom teeth were not coming in and I was probably a couple of years away, he would extract. 4 wisdom teeth extracted with no pain relief. And let me tell you, that was a cakewalk compared to what was coming. Once we realized my issue was not going to be solved as quickly as it came, my mother decided it was time to seek more professional help. My next stop was at a psychiatrist's office. After asking me some basic questions about my life and my background and why I was there visiting that day, he decided that the pain in my head was exactly that. It was all in my head. It was amazing. It took him all of 30 minutes of knowing me. See, I was bullied pretty bad as a kid, like many children are. I didn't have the traditional upbringing, and because of these stressors, he proceeded to diagnose me with somatoform disorder, meaning that the mental disorders or the mental stressors being experienced in my life were so significant that they were manifesting themselves in physical ways. Suicide headaches was my case. His recommendation to my mother, tell him to just make it go away. He has the power to make it go away. Don't give in to him when he's screaming. Sorry. Bless my mother for doing what she would do, taking the advice of a professional before consulting the internet. We took it as fact and we went down that path. Weeks passed, 3 to 7 attacks a day in bed or on the couch, store, school. And my mom the whole time would just say, just make it go away. It was really hard for her to say, as it was for me to hear. The mental torture experienced on top of the physical of an already completely debilitating disease it was too much. After a couple months of this, it was clear I couldn't make it go away. The psychosomatic diagnosis was the biggest blow to my mental health to date. To know the pain is so real, but the world tells you it isn't, is a special kind of prison-like torture. We found a local GP who was willing to see me. Her name was Dr. McDonald, and at this time I was about 15. Dr. McDonald met with me, got caught up on my history, and came straight out with it. I don't know what this is, she said, with a puzzled look on her face. She did some thinking and said something like, okay, I think this is adolescent migraine and that we can treat it with Topamax. If that doesn't work, I'm going to refer you to the Diamond Headache Clinic in Chicago. See, there were no neurologists around my area that were willing to see someone so far under the age of 18. I was rejected by the medical community as faking it, and all because I was experiencing something unfathomable by the all-knowing and seemingly omniscient physicians. It just wasn't possible my pain was real. But she was so humble in her approach and realized she was out of her league immediately. But she did her duty as my physician to try and relieve my pain. To this day, I'm most grateful for her willingness to relinquish my care to Diamond as she promised, if the regimen was unsuccessful. I was on Topamax for a little over a month before I tapered off and sent for my first visit to the Diamond Headache Clinic. There was no change. Day 1 at Diamond, age 15, Dr. Seymour Diamond requested my case and quickly became my life-saving headache doctor. From the moment he walked into the room, he set his cane on the table, for those of you who may know him, looked me in the eyes and asked, "What does your pain feel like?" Only this time when I answered, instead of feeling like my words were going in one ear and out the other, while he thought about what was really happening with me, he seemed to be digesting my words and truly listening. He sat down, he didn't say a word, he flipped through a book and proceeded to say, "I'm sorry to say that I think you have cluster headaches." I wasn't sorry. I had a name for my condition. I finally had one answer. He never led me astray by telling me he had a simple fix. He never pretended to have all the answers, but he listened to me as his patient and he tailored my treatment around what I said worked for me. If biofeedback wasn't working for me, I never had to do it again while I was admitted on their hospital floor. If I was taking 3 to 4 times the dosage of Toradol that a normal, fully grown man would take, I could continue taking that as long as my kidney functions were fine. Now, the DHC never cured me. They didn't actually fix or reduce my headaches at all. In fact, because of all the meds I was on, over 40 pills a day, my cluster headaches evolved over the next couple of years, and I began having more and more. Up to 14 one-hour attacks in a 24-hour period on a consistent daily basis at the age of 16. We couldn't figure out why. Maybe I was just growing into them and they were progressing. I became classified as treatment refractory and nothing worked, but at least Diamond tried. For 2 years, they gave me a shot at treatment and put me on a path to longer-term recovery because of their ultimate failure to successfully treat my pain. At age 17, my mother divulged to me some research that she had done online. At this point, we were desperate and would have given anything to bring relief to my life. She explained to me about an online support group she came across by the name of Cluster Busters. You guys have probably heard of them a couple times. This is a community where people that have been failed by the traditional medicine system, their doctors, and their treatments can turn to, not only for emotional support, but to what I would call the cluster headache holy grail of information. This ended up being the single greatest discovery of my life. The access to information that was available outside the realm of Western traditional medicine was truly invaluable. Now, I understand your positions hold you to certain standards, and while I respect that, there was a particular doctor at the Diamond Headache Clinic who, when presented with our research, after years of pain and thousands of headaches, said, "While I can't tell you to do this, in your case, I wouldn't leave any stone unturned." He wished me well, and that was one of the last times I saw him, other than following up to share the massive success from my new treatment. Immediately from then on and to this day, I pursued alternative forms of medication. Busting, as we call it, is the method we use to attempt breaking cycles and or facilitating a full remission by utilizing the chemical structure similarities in the psilocybin mushroom, LSD, LSA, and serotonin molecule. These molecules are so similarly structured that the psilocybin, LSD, and LSA can supplement serotonin deficiencies in the empty receptors, and that is shown in many to be a key component in their treatment, with many responding very positively. With subhallucinogenic effects, ingesting less than the recreational dose, and in some cases even microdoses, many cluster headache sufferers have been able to mitigate attacks on multiple fronts, and numerous citizen scientists have gone into complete remission using a maintenance dose once or twice per year. To this day, with the help of some of the most impressive doctors and human beings I've ever met, I have experienced the greatest pain reduction and frequency in my 14-year cluster headache career, even if it took enduring over 30,000 attacks in the past 12 years. I appreciate your time and your willingness to learn from us.
Wow, thank you so much, Andrew. And now, Bob Wald, I almost said Dr. Wald, might as well, honorary, is going to address us, and he has a few slides. Maybe if you could cue them up there at the back.
Well, thank you, Brian, and thank everyone here at Hackney for making this possible for us to be here. I really only have one disclosure. I've had cluster headaches for 40 years, so, and been volunteering as an advocate for 20. So, this is a really important milestone for my entire community, for us to be here. For you to want to hear the voice of cluster headache patients. I love seeing everybody sitting here. I was told not too long ago by a fairly well-respected headache specialist that doctors don't want to or don't think that they can learn anything from patients. And I think that just by you sitting here, you proved him wrong. So thank you very much. I know one other thing that goes on at a lot of these conferences that you try to work and improve on doctor-patient relationships. And I think that it's important to hear from the patients and not just a doctor talking to another doctor about how to improve his doctor-patient relationships. So once again, thank you for having us here. There's a little thank you to everybody that is staying here. On our website, we have a preferred doctors list. Over the last couple of years, we've had about 1 million hits, and one of the most visited pages is our list of preferred doctors. So if any of you would like to get onto that list, there's a bag on the table back there that says preferred doctors list. So if you want to just drop your business card or your information in there, we will put you on that list, because at the end of my presentation here, and all of us, I think you will all be trained a little bit better in cluster headache patients. What I'm going to do is try to merge my story with what is a typical story for most people in the cluster headache community, and try to give you a feel for what it's like to have cluster headaches and to have your world turned upside down. This is a fairly typical family that's right about at the age group where the majority of people first come in contact with the cluster headache world. I was about that age. I had a beautiful wife, 2 kids, and the only thing that was close with me with this guy was I used to have that much hair. So now I'm actually the only male child in my family that still doesn't have that much hair. I think a lot of that is from a lot of the medications that I've been using. One day, we've got the family like that. We're beginning to build our life. We got life set on cruise. Everything's coming together. We're working hard, enjoying life, and find myself up on one of the decks and feel myself hit on the side of the head with a 2x4. So what happens? Knocks me right off of the life that I was leading. Find myself drifting in the water, trying to save myself, not knowing at all what's going on, not knowing how I can get help, who I should be calling for help for. Nobody can hear. And I see my life trailing into the distance and really not understanding at all what it was that I had. And the period it took for me to be properly diagnosed was 4 years, which is very common in cluster headaches. And that number is coming down, I think, a lot with the help of a lot of the people that are in this room. It used to be more of an average of about 8 years before you got the proper diagnosis. I went through all the same stuff everybody else did with root canals, teeth being pulled, not knowing what it was because my cycles would last 3 months. We would try something, it would go away, and we thought that we found whatever it was that would be helping. So while I'm out there all by myself, not knowing what to do and not knowing how to find help, I had to deal with this thing that everybody with clusters tries to put some sort of a personality on this entity that's living in our head. So while I'm trying to keep up with my life, we've got this guy pulling me down for an hour underwater 5 or 6 times a day. Very difficult to keep going with your life that you had planned. Finally, some help comes along. Somebody comes and tells me that he can help me and actually gives me a correct diagnosis. It was the first time I'd ever heard the word cluster headaches. It had been 4 years. And I had before that I had an MRI after I'd seen a chiropractor, and he had told me that if he couldn't cure me, then I probably had a brain tumor. So after 3 sessions with him, my head was worse. So I thought for sure I had a brain tumor. So I went and had an MRI, waiting for the results. And I can tell you this honestly, and I've talked to other people with the exact same situation. I was very disappointed to hear that I did not have a brain tumor. I didn't care if it could have been cured, but at least we knew what it was. There was a possibility of getting rid of it, and I would have some sort of a sight on my future. So that was one of the biggest disappointments in my life. So I thought help was there. So what does the help throw me? It throws me a fire extinguisher. Well, I'm not on fire, I'm drowning. Let's try this medication. It's an anti-seizure medication, but it works for 30% of migraineurs, so let's try it for your clusters. Well, that one didn't work. So they tried another one, and that one wouldn't work. Change it up a little bit. And all this time I'm trying different medications that are not working, my life is further and further in the distance. I hate to correct Brian a little bit, but it wasn't 65 medications. I'd actually tried over 70. None of them worked for more than a couple of weeks. So now I still had my cluster headaches, memory loss, heart disease. I've had 2 heart attacks. So much prednisone that I've had major issues with avascular necrosis, an opioid addiction, and a lot of other things. So throwing those fire extinguishers, hitting a lot of different areas that they weren't supposed to be hitting in. So that was the first 20 years of my cluster headache life. And then what happens, I end up on Gilligan's Island. I'm floating around, finally found some place that I could feel like I wasn't drowning anymore. I was with other people that had the exact same thing. So about 20 years ago, I formed a online support group. This was before there were actually even groups online. It was very new at that point. But what I did find out by meeting these other people with clusters is we were going to try to figure out things that could help us. And the internet was very instrumental in that because we could do a lot of research. And over the years, we have found a lot of different things that a lot of people with clusters use to help in one way or another, either the physical issues or the mental issues that we deal with. For most people with clusters, there's a long list of things that are in their toolbox that they need to get their life back on track. Okay, so these next slides that I'm going to show some data that's been collected on a study by Dr. Larry Shore from the University of West Georgia and Dr. Mark Burish, who's in Houston. And it's actually a study that has a lot more participants than the Rosen study, so it's going to be giving us a lot of great information. This first page shows, I still think that we have some faulty demographics looking at cluster headaches. When I first started in this, the male-female ratio was 8-to-1, and now it's somewhere between 2 and 3-to-1. The other thing that has not changed since then is they're still looking at 1 in 1,000, but with that number changing, what I think is happening is we've added a lot of women to the list. We haven't lost any men, so my guess is that there's a lot more than 300,000 people in the U.S. with cluster headaches. The other thing that shows up on this chart is the age of onset. I'm going to get a little water here. This is one of the issues that we're really concentrating on now at Cluster Busters, and we feel that there's a real need, and that is pediatric clusters. There is no information online about it. I talked to a lot of doctors that have no idea that, number one, that people that young get cluster headaches. I know people that started out at 6 years old. I know people that started out at 4 years old. I know one guy that swears he started out at birth, and it very well may have been. So on the one end of this scale, Brian mentioned some of the calls that I get. A lot of times when people stop calling you, they end up calling me. And one of the reasons that is that I made the fatal mistake of leaving up a video that had my personal phone number on the back of my PowerPoint. So I get a lot of phone calls. But if somebody watches that video at 8 o'clock in the morning in Australia, they call me not knowing what time it is, where they're calling. But so I get calls 24 hours a day. So on the pediatric end of the scale, one of the phone calls I got was from a mother who had just taken her 11-year-old son home from a headache specialist who diagnosed him right away with cluster headaches, but started him on 200 milligrams of Topamax, told him he would go up to 400, and that he would have these cluster headaches the rest of his life. That was his first visit, and it broke his heart and his mother's heart to hear that. I mean, she hated the fact that her son was told that there was no help. This is what we're going to do, and you're going to suffer like this the rest of your life. At the other end of that scale, I know a lot of people talk about people growing out of clusters in their 50s. When I was around 50, hoping that might still be true, but also knowing that I knew other people that were older than me that still had them. I actually got a phone call from Belgium one night from a 77-year-old cluster sufferer, and she wanted to talk to me about her 99-year-old mother who had clusters in a nursing home and wanted to know if it was safe to give her magic mushrooms. So that's the oldest person that I know of that has cluster headaches. And we did safely end her cluster headache cycle, by the way. So from the same study, these are some numbers based on a pain scale for clusters, where people with cluster headaches were asked to compare their pain levels with their clusters to other things that they have gone through. So clusters came out at like 9.6. 432 women rated their childbirth at 7.13. Some of the other notable ones, heart attack 5.2. I can certainly attest to that. Gunshot wounds, I don't know why so many people with clusters have gunshot wounds, but they were only rating them at 6.24. Stab wounds, we've got a lot of those. And I think some of those were probably self-inflicted. And so that's all the way down to 4.6. So that's less than half what cluster headaches are. Another call that kind of relates to this one is, I got a call from a guy in London. This was probably back in June, looking for help because he couldn't take this pain anymore. He was seeing a very good physician, but when he called me, he was splitting some of his Imitrex injections, which I'll talk a little bit about later, but he was giving himself up to 16 shots a day of Imitrex and didn't know how much longer he was going to be able to live. So we flew him out, and he came out to our conference in Chicago in September, and we almost have him off of Imitrex, and he's doing much better. So every time he would call his doctor, the only thing he would get there were refills on his Imitrex injections. Suicidality, 20 times the national average. Most of the time, if people think of suicide most of the time during their attacks, 10% of the people go through that. And if they're going through 3 or 4 attacks a day, then they're thinking about suicide 3 or 4 times a day. And I have lost a lot of friends and a lot of people over the years to suicide. It's a very difficult thing getting these phone calls. A couple of calls that relate to this was, I got a call about 3 o'clock in the morning from Las Vegas. A woman didn't know where she was calling, couldn't believe that I answered the phone. And she had just taken her husband home from the hospital recovering from his suicide attempt, and she didn't know what to do for him. He had had cluster headaches for 29 years in Vegas, had seen a half a dozen neurologists, and had never heard of oxygen for a treatment. There were very few options that he had been given all of these years. When you get these calls, you really don't know what the whole story is. I don't know medical histories or whatever else is going on. But to find out how much information this guy didn't have after almost 30 years of cluster headaches was just terrible. And there was no way he was going to end up anywhere but dead through suicide if he had followed that. Another one, I got a call last year from the father of a 26-year-old perfectly healthy female, an athlete, an artist. And the father was on his way to the hospital to pick up his daughter who had a heart attack due to Imitrex. She had been taking 6 full injections every day for 6 months straight. So now I've got 2 people on the phone that want to end their lives. The daughter can't live like this anymore. The father can't stand seeing his daughter go through that. He didn't know what to do because he couldn't take the Imitrex away from her, because he couldn't watch her go through an attack. So we talked for quite a while, and she also had been prescribed all of this Imitrex. It wasn't like she was buying it off the street. I don't know, some cluster people can only get 6 shots a month. She was getting 6 shots a day without oxygen. So what we ended up doing actually was they had a summer house on an island. Her mother took the daughter to the island with no Imitrex, and I had sent them oxygen bottles. So she went through Imitrex detox for 3 days, just used oxygen, and just that 3-day detox, her attacks went down to like 1 per day, and she was treating those with oxygen. So those are the types of phone calls I get. Back on patient contributions and what we've had to do when we all found ourselves on Gilligan's Island and on our own in a lot of ways. A lot of these things on this list, most cluster headache patients are using in conjunction with a lot of the prescriptions that they're getting. The special cluster mask that's used was designed by a cluster headache sufferer that was a respiratory therapist. He designed it and then gave it to eventually to a manufacturer to make, because he couldn't keep up with the demand. So I would beg all of you that if you have a cluster headache sufferer and are prescribing oxygen, please tell them to get this mask, because it works 5 times better than a standard non-rebreather mask. Because of the community, we really got high flow oxygen used by everybody that knows about it, and if they can possibly get a prescription. If they can't get a prescription, they do go get welder's oxygen. But a lot of them now are using all the way up to 25 liters per minute or demand valves, and it makes a huge difference to change a 45-minute attack into 5 or 10 minutes. The vitamin D regimen has been around, 10 or 12 years, quite a while. A lot of people are using that. One thing that seems good about it is that people that do get on it usually stay on it for an awful long time, which is telling us that it is working, at least providing some relief for people. Because cluster people are really picky these days. If it's not working, they get off of it. So if they're staying on something, there's a reason for that. Cluster Busters is involved in a lot of research with psilocybin and LSD and LSA. But as you can tell, that's a part of what we do. We fight harder for oxygen for people than we do for psilocybin. And I think the big point to remember about psilocybin and the psychedelics is what we're looking to do is see where that leads us. And one of the places that it led us was to BOL 148, which is a non-psychoactive molecule. It's a little similar to Sansert. So if you were using Sansert before and can't get any more, hopefully we'll be able to get BOL on the market and you'll be able to use that. What makes BOL safer is that instead of taking it every day like you did with Sansert, you only need to take this 2 or 3 times. People are using energy drinks. We think it's the taurine that's in them. They'll down those really quick as soon as they feel a cluster coming. So they're able to stay away from a lot of other medications just by using those. And they try not to use too many, we do understand some of the dangers in overdoing those. Ginger tea, I don't know if you've ever heard the word shadows with clusters, but if you have cluster patients, if you just ask them what they do for shadows, you're going to make a heck of an impression on them because they'll know that you know quite a bit about cluster headaches. A shadow is a community term for a cluster headache that starts but never peaks out. It may just get up to like a level 1 and it gets stuck there. It's very aggravating. Sometimes people try to do something to trigger it to actually go full blown so it goes away. But they're able to treat some of those with ginger tea. Splitting Imitrex injections. It only takes 2 milligrams to treat a cluster headache, not 6. So people either, they try to get the vials prescribed. If they don't get that, then they'll bastardize the auto-injector and inject 2 milligrams at a time with a Q-tip. So just a few other of the things that we're doing over there. So I'll just go through this real quick here of doctor-patient relationships. We did a quick survey of one of our groups real recently here just to get an idea. So I can let you know what the patients think. And don't kill me, I'm just a messenger. So why these patients stay at their doctor? Number 1 was if they have cluster headache knowledge, if they know what they're talking about. Willing to learn, willing to work with the patient, will listen to the patient, up to date on treatment options, understands that everyone doesn't just fit in the same textbook, understands the seriousness of the issue, and won't give up on me. A lot of people in my community have been given up on by their doctors. And why I leave, why I have left previous doctors. No understanding of cluster headaches. Women don't get clusters. Doctor gave up, refused to prescribe oxygen, unwillingness to try anything off his list, inability to listen, feeling of that they're just throwing darts, waiting too long for an appointment. If your cycle is starting and they start quick, and if you go to 0 to 6 attacks a day and you call for an appointment and your doctor tells you, well, we'll see you in a month or 6 weeks, they're going to hang up the phone and call somebody else. And the last one is the feeling of being some kind of sending going on. I can honestly tell you this, cluster headache patients are very well educated about cluster headaches. They've had to do it out of necessity. They get online, they read studies, they read the research. They know what works, what doesn't work. And when something comes up on the internet that they know isn't going to work, everybody chases them away really quick. So you aren't going to get too many cluster patients coming in and asking for a daith piercing. If I could see a raise of hands of anybody that has never seen anybody with a cluster headache or a video of a cluster headache. Anybody out there? Have you all seen what one looks like? An actual attack. Wow. So you've all seen live attacks from your patients, or you've seen videos?
Ever or never?
Ever or never?
Did you say ever seen
I'm just wondering how many people have never seen a person in the middle of a cluster headache attack? Okay, never seen one. Okay, I'm going to show you a brief clip. This young lady is from Denmark. She was told that the last thing that they had to offer her was a stimulator implanted in the back of her neck. And if that didn't work, then they were out of options. She was in the hospital. This is after the stimulator was installed. Well, if anybody wants to see this video, I mean, I can give you the link, or you can come over and take a look at it on my laptop. But this is a very good example of what somebody says is a level 10 cluster headache attack. And she was having these attacks after she had the stimulator inserted and was supposedly working, and it obviously by looking at her you would be able to tell that it's not working. So one of the worst things somebody can hear is, well, this is the last thing this is your last opportunity. If this doesn't work, then there's nothing else. Almost everybody that's ever been told that I know, whatever it was that they were offered as their last opportunity didn't work. So then you have to try living with that. So thank you very much for sticking with me while I tried to get that out. It's a difficult thing for me sometimes, so thank you very much.